Hello, this is David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is the basics of migraine headaches. What is a migraine exactly? It's a chronic headache that affects people anywhere from a few hours up to 3 days straight. It's a complicated recurrent headache disorder that's most common in women and those between the ages of 15 and 55. Usually, migraines become less severe and less frequent with age. How common are they? They do affect 18% of women and 8% of men. 30 million people in the U.S. have at least one migraine per year. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% of those with migraines have a first-degree relative who suffers as well. If one parent suffers from migraines, there's a 40% chance the child will suffer. If both parents have migraines, there's a 90% chance. And over 90% of sufferers are unable to work or function normally during a migraine. There's a lot we don't know about what causes migraines. We do know there's a genetic and an environmental component. We know that there's an imbalance in brain chemicals, specifically that serotonin levels drop during the event. Low serotonin levels can trigger a migraine by letting too much blood flow through the vessels that should actually be constricted, and that can induce the throbbing sensation. What are the typical migraine triggers? There's actually a lot of them. Food can be a significant trigger, such as red wine, beer, whiskey, additives in foods, cold foods, citrus fruits, MSG, caffeine, types of cheeses, elevated stress or barometric weather changes, strong scents like perfume, maybe a ponytail that's tied tight, certain types of exercise, poor posture, skipping meals, and even smoking. Thankfully, the small silver lining here is that there is no evidence to substantiate that chocolate is a trigger of migraine headaches. That is actually a myth. So symptoms are going to vary, but it's often a unilateral head pain that is throbbing and aggravated by activity. The aura is actually not present in 80% of migraines, and that's a visual or sensory symptom prior to the onset. Diagnosis, there's really no objective testing available. A CT or MRI scan will be done at some point during the workup to rule out a tumor or something else going on. It's usually diagnosed on patient history and pattern of symptoms, so a migraine diary can be very helpful to show the severity and frequency. Making the diagnosis, the International Headache Society requires patients to have at least 5 attacks fulfilling 3 criteria. One is a 4 to a 72-hour duration, at least 2 of these unilateral, pulsating, moderate to severe intensity, aggravation by or causing avoidance of routine physical activity, and at least 1 of these, nausea and or vomiting, photophobia or phonophobia. So there are various abortive treatment options, meaning you're having a migraine, so medication to try and abort it. Various types of triptans, which may include almotriptan, elatriptan, frovatriptan, naratriptan, rizatriptan, sumatriptan, which is the most common, and then zolmitriptan. All of these target the serotonin levels to help constrict. Caffeine is also another first-line abortive treatment option. Additional abortive treatment options may include Migraine nasal spray, Migraine nasal spray, Cafrago, and then over-the-counter options such as Advil, Excedrin, or Migraine. Additionally, narcotics, barbiturates, or anti-nausea medications may help a lot, such as Reglan or Compazine. Now, preventive treatment options are those that are given, prophylactically to try and prevent the migraines from happening. Off-label medications such as beta blockers or calcium channel blockers, maybe antidepressants can help avoid migraines. Also anti-seizure medications such as gabapentin, Depakote, Topamax. And there's also a serotonin antagonist called cenobamate that can help. Various interventional treatments such as Botox injections can be really helpful. The FDA has approved those to be given in 3-month intervals. It's actually a 10-minute procedure, but it involves 32 small injections. It is covered if certain medications have been tried and failed. If somebody has 15 or more days per month with migraine headaches lasting 4 hours a day or longer, that defines chronic migraines, and Botox can be covered. Additional treatments may include occipital nerve blocks, cervical facet injections, cervical epidural injections, phenopalatine or supratrochlear blocks, supra or infraorbital, and then a pulsed radiofrequency ablation of the occipital nerves. All of these can be really, really beneficial along with the Botox options. So a study of 100 patients getting a greater occipital nerve block showed that 53% achieved pain relief averaging 3 weeks. There was another study looking at greater occipital nerve blocks which used lidocaine and steroid. 54% reported being significantly better up to 6 months. And then one more looked at 27 migraine patients and showed an 85% effectiveness, but that was upwards of 10 injections with effectiveness for 6 months. The top non-operative pain management in the Chicagoland area is with Premier Pain Specialists. There are several clinics throughout the greater Chicago metro region accepting over 50 insurances and providing over 25 different treatment options. The success rates have been very impressive for migraines with the board-certified award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-220-7907. Thank you very much for watching.